A governor in the South who had banned mask mandates even as cases and hospitalization surged in his state has now contracted COVID. Texas Governor Greg Abbott, a fierce opponent of mask or vaccine mandates, reported today that he has tested positive for COVID. Here he is at an event just one day before testing positive. The governor has been fully vaccinated and says he has no symptoms. He will isolate at the governor's mansion while he receives any medical treatment that he may need. Things in Texas are getting so bad that health officials have now asked the federal government for several mortuary trucks, as deaths there have tripled in the last 2 weeks. And now the NIH director is warning that kids are very seriously at risk as the number of children hospitalized with COVID continues to surge across the country. It's leaving many children's hospitals overwhelmed, particularly in the South. Nearly 2,000 children are now hospitalized with COVID-19, a new record, according to the Department of Health and Human Services. Sadly, more than 520 children have died from COVID since the start of the pandemic. Though we don't know exactly why the numbers are rising so quickly, some experts say the Delta variant is most likely impacting younger people more severely than past variants. In Mississippi, 5 children have now died from COVID. The 5th child passed away on Saturday just hours after testing positive. She had attended classes for most of the week before becoming ill. Smith County, where 13-year-old Makayla Robinson attended school, has the state's second lowest vaccination rate. The state overall currently has the nation's second lowest vaccination rate at 36%, above Wyoming and behind Alabama. The state also does not have a mask mandate for schools, despite several Mississippi health organizations like the State Medical Association and the State Department of Health supporting mask mandates for K-12 schools. Joining me now is Mississippi Delta Family Medical Residency Program Director, Dr. Evelyn Walker. Dr. Walker, walk us through what is happening with our children. Is this variant just behaving differently when it comes to children than the other variants did, or is there something about the way we are behaving as a society, not putting on masks as much as we did, not social distancing as much as we did, getting back to normal, as we say, in a way that's putting our children at risk?
Thank you for having me. Actually, I think it's a combination of both those things. It is that this Delta variant appears to be more virulent in children, unlike the initial infection. And also the leniency now that many of our school systems have shown as far as requirements for wearing masks. So that protective barrier there that masks represent has not been there, especially at the start of many school systems' school year this year. So it has been kind of like creating a perfect storm in that, you know, we have the Delta variant, which is far different from the initial variant of COVID. And then we do have this just laxity in the requirements for protecting our children in the schools.
So, help us also understand, the resistance to mask mandates. It's one thing I can kind of understand on some level being hesitant about a vaccine. Something that's going into your body, you don't know what it is, it hasn't been approved by the FDA fully. I get all that, even though the science says it's perfectly safe, that, almost no one has died of the vaccine. 600 plus thousand people have died of COVID in this country alone. But masks is different. It's not going to hurt you. There's nothing a mask can do that could hurt you. It could only help. So what is the resistance to a mask mandate in Mississippi and other states?
So, unfortunately, I think that it goes back to, the early opinions about masks and the negativity that was ascribed to it by some of our leadership. And I just think that has just stuck. And we here in Mississippi, or some of the Mississippians here, have basically put a very negative spin on the wearing of masks. They talk about it's taking away a freedom to not wear it, freedom to breathe. There've been several things said about about wearing masks or that are against wearing masks. And I think it all just stems from the negative spins that were put on it very early on in this pandemic. And it has just persisted, and at a time when it should not be, when it's clear, especially in the schools, that wearing masks would only be of benefit to our children and to our children's safety.
And, and what do we tell to the parents, when we talk about children under 12? They cannot get vaccinated, right? So it's not a choice for them. What do those parents of those younger children say? They're completely exposed to this. The children who have died have been, some of them incredibly young, in the range of people who could not have gotten vaccinated even if they wanted to. So how do you convince parents particularly of the very young, that it is imperative to protect those children, that everyone in the community wear the mask and get vaccinated, but also everyone in school wear the mask?
Mm-hmm. So, yeah, and I think parents, and it has been amazing, the response that some school districts have received from parents who just do not want their children to wear masks. They are not thinking of this as a team effort, and how wearing masks actually not only protects their child but other children that their children are in contact with. So it's difficult to understand, and certainly it's not something that we're able to explain. But because of the backlash when school districts have tried to implement mask mandates that they get, some school districts have chosen not to implement those mandates, and it's kind of beyond our understanding.
Are you at least seeing an uptick in vaccinations as cases surge around the country, but also in Mississippi?
Yes, we are seeing some. Our State Department of Health actually has provided some positive news on that front, in that we are seeing more. Our vaccination rates are going up, and the problem with, and that's that's great news. That's good news, but our vaccines will take at least 6 weeks to really become effective and to really protect completely from the COVID infection. So it's a good thing. It certainly is. And we're doing many things to encourage and to promote these vaccinations. But I think the vaccinations, along with mask wearing, and in addition, other forms of protection, hand washing and social distancing, all of that we did initially in the pandemic very much still applies, along with the promoting the vaccines.
Dr. Evelyn Walker, thank you for your time. Also, thank you for all the work that you're doing in Mississippi to help everyone there, particularly our children. Next up, we'll discuss the growth of an increasingly multiracial America. You're watching Prime on BNC.